Welcome to Go With Your Gut podcast, where we discuss everything related to gut health as it pertains to children, teens, and young adults. I'm Norma Fled, and I'm an integrative and functional nutritionist. Now, in previous episodes, we got to hear from 3 young guests that shared how lifestyle and food, among other things, had a great impact on improving their health. And that's why today I'm excited to introduce Dr. Lisa Loegering, who is a integrative developmental pediatrician who is also board certified in functional medicine. And she will be sharing how our functional approach can be used to support mental health. Can't wait to get started. Hello, Lisa. How are you doing today?
Great. Thank you, Norma. I'm excited about everything.
Yes, I think we're both excited. So we're just jumping on each other here, just interested in really getting the word out. I think both of us share a very strong passion for, a different approach to treating mental health that really gets to the root cause. And so I have a question for you, especially you started out as a pediatrician. And
Right.
So was there a specific event that led you to studying functional medicine?
So I was both a pediatrician and a developmental behavioral pediatrician. So I was already in the ADHD and autism space. And I was always interested in integrative medicine. But many years ago, it was hard to figure out which groups were reputable. I was part of Scripps Clinic. It's really important to me that the information that I learn and use be science-based, and it was just hard to figure that out initially. But I would see results with some of my patients who were seeing other practitioners. And then eventually I just stumbled onto functional medicine as part of integrative medicine. And I went to one of their conferences. I loved it. And that was kind of it.
How it started out for you.
Right. Yeah.
Yes. So how many years were you practicing before you discovered functional medicine?
Oh, at least 15 years.
15 years.
Yeah.
And then how long have you been practicing applying functional medicine in your practice?
About nine years.
Long time. Yes. Lots of experience to share here today. So again, excited to dive in. So what I'd like to know, especially, you said you were seeing a lot of ADHD clients as well as autistic clients. Do you find that that is still the majority of the types of patients that you treat? Or is it general mental health as well? How would you describe kind of the scope of your practice?
Well, in my prior practice, I was in general pediatrics. So I was a general pediatrician, and I just had some of those other patients. Autism was much more rare, so there were not that many autistic kids at that time. It really didn't become common until started the 90s to become a bit more common, and then the 2000s, and it just went up from there. But I wasn't specifically trying to see ADHD and autism. Now, that is my specialty. I don't do general pediatrics. I only see patients with autism and ADHD and some other like mental health or complicated medical problems.
Okay. And would you say there are more ADHD versus autism, or is it about equal in your practice?
It's about equal, half and half.
Half and half. And so if a person comes in to see you, and I should first ask, what age range do you see?
Really, all ages. My youngest, I don't see newborns or babies because how can you tell what's going on with them? I mean, they don't.
Behavior-wise.
Yeah, they don't have autism or ADHD. I get inquiries about babies, but I don't generally I wait till they're a little older. So my youngest would be 18 months to 2 years where they're at risk. That's how they're presenting, the moms, or they've been identified for some reason as being at risk for autism. So that would be my youngest, 18 months to 2 years. My oldest, probably autistic kid, is 35. So, so I will, do, pretty much all ages, however, usually not older adults.
Right. And so you had mentioned those that are determined at risk, especially for autism, 18 months. What are some of the signs of a child at risk for autism?
Well, oftentimes they've been identified at birth as being either premature or small for gestational age, or having, an NICU stay, some sort of delivery problem. So they often would have been identified by the system as at risk given those circumstances. If that wasn't the case, then the parents might be coming in and seeing a lack of language development or social skills, but there's not as much to really look at between 18 months and 2 years. There are language skills, but every child is slightly different, so you can't just make a judgment unless it was severe. So part of the kids are pulled out by the system just because they have known risk factors. And then the other part might be that the parents are noticing things that they're worried about.
In their behaviors, right?
And behaviors and language and irritability, eye contact. But again, it's early. It's early, so I'm not usually going to make a judgment 18 to 2 years.
Right. And so when you're assessing a child that comes in, I'm sure you have I know in functional medicine, there tends to be a very thorough, long intake form or questionnaire that they need to complete that obviously, as you said, starts at birth and family history. What are some of those major things you look at? Is there any testing that's required before they come in?
No, I actually don't I'll look at everything they've had or other doctors have done, but I want to get the intake so I can decide on the most appropriate testing. And the nice thing is children have a little bit less of a past history because they're younger. So it's not as complicated as an older adult. However, I'm really focusing on things like sleep and diet and have you been on supplements? What's the stress level like? And in the home, if they're school age, do they like school? School can really derail kids or be a positive thing. So I'm really trying to focus on all of their kind of lifestyle variables and then decide about the testing. And there is common testing I order. If someone's 18 months to 2 years, I might start a few supplements based on what I'm seeing. I might do like a hair test, which isn't as accurate as a blood test, but I might be a little less apt to do a lot of testing until they're a little bit older. But certainly if they're over 2, and depending, usually the younger ones have been singled out for autism. They're usually not noticed to be ADHD until they're at least 5. Like my ADHD patients, often they were active during their early years, but it's only once they're in school that people are noticing focus problems or learning problems. So my younger kids, I'm probably more seeing with the autism diagnosis. And I do a certain number of blood labs because I need to look at nutrient deficiencies. And also, there are biochemical weaknesses that occur in both kids with ADHD and autism. And I need to see what those are and what those levels are. And for instance, if you're low in iron, you may not make
Right.
dopamine, which is part of the ADHD picture. So I don't want different health issues contributing to the picture, especially
Correct. Right.
health issues that I can fix. So,
Right. Well, I want to jump in here actually because it's got me thinking because of my own son, who I did bring into you many years ago, and that's how I found you. And in his case, ADHD, and it's, for kindergarten, first grade, and the teacher starts making comments, even suggesting medication. And so looking into that, not only my son, but most kids just terrified of needles, and especially a blood draw. I know that can be a real challenge with testing. And so, like in our case, we did the organic acid test, which at least can give us an idea of some functions. And like you said, the hair test, the Pyral test, which is a urine test. So fortunately, you can still get answers. And then I'm sure you see a lot with their digestion, constipation, skin issues. Correct? I mean, are you seeing that too, where it's related to their digestion sometimes?
So, first of all, their diets are often not great, although there's some families that are just wonderful and doing everything right. So shout out to those families who got it down with the whole food. But in our culture, it's you go against the tide, especially once your kids start school, when you're trying to do a whole foods, organic, healthy diet. The bad food is just everywhere. So yes, and I don't even start working on the microbiome until I figure out what the family's willing to do. Because you can't treat a gut issue and then, have the child start back on junk food, because a lot of the changes that you might have made in treatment will just reverse back. So you really have to have buy-in from the family.
Right. And if I could add there, what I've found just because I am a functional nutritionist, so obviously nutrition is going to be the largest component of what I do, that I agree, you have to first delve into what is that family willing to do. And that's why we're looking at their lifestyle. Are they packing lunch? Are they willing to pack lunch? What kind of schedule do they have? Are they willing to cook? I don't love cooking. I share that a lot. I share a lot of simple ideas as much as possible. So one thing for certain is that is why nutrition counseling is so important, because I spend a lot of time trying to bring it back to their symptoms. And even with kids, even with my own children, how does it make you feel? We can't just tell them what to do, but if we can keep taking them back to, well, how does it make you feel? And recently, I had an 11-year-old that they didn't even make any other changes except for their diet. And she couldn't believe how her child's temperament went from 5 temper tantrums a week to 0 just by making the dietary changes. But she has had to keep a journal that she shares with her child. Hey, look what happened when you had this. And I guess it's always a strategy, right? How can we keep... I think they call it motivational interviewing, when we're trying to really help people understand how important it is. But it's challenging with our culture and fast pace and needing food quick, and how good fast food tastes. That in itself is a challenge.
So my feeling is that I have a number of patients coming and wanting medication. And so I want to make sure that whatever else is going on in their life, that that it will make the medication work better, or it won't at least derail the focus that I'm trying to improve with medication. So, for instance, I would like to stick to the lowest dose possible of a medication, and I want to make sure that the kids are eating well and getting protein at every meal, not getting these sugar spikes up and down. I want to make sure that they're getting enough sleep. If you don't have sleep, you can't focus, and medication's not the answer for someone not sleeping, which comes up with the teenagers a lot. So eating, sleeping, stress. If you hate school and it's just not a good fit for you, for that particular classroom or setting, then the medication is just not going to work as well. So we want to get all the pieces of the puzzle together, and we want everything integrated. And so that so that personally I can stick to the lowest dose possible of medication if we're going on that route. And we don't always go on that route. We can solve a lot with supplements, but it just depends on the child.
And that's what I love about your approach, because anyone can really seek your support, no matter where they're coming from, whether they're, hey, I need to take medication. This is such a big challenge, and I kind of need to get a good start because I just feel so hopeless, right? And really that integrative approach where you're still looking at the root source of the problem so that the medication can work better. You need a lower dose. It's more effective, fewer side effects. Or like you said, they can, if their goal is not to take medication, they can take additional steps. And just really there's that individuality that is honored in each person. And so speaking of which, what are other challenges? You talked about diet being one of the biggest ones. What are some other issues that are very common that you see, other than sleep and the stress at school? What also do you find are things that come up a lot in ADHD or autistic patients?
Those are really the main ones. I would say the diet is huge. The school lunches are huge. Our culture is fast-paced and stressful. I would say that's huge. Kids need a simple approach. It's not complicated, but we make it complicated because our food is, not good. We watch too many screens. So I guess screens are another thing that comes up, especially with the boys with ADHD. And yeah, that's a huge issue. The dopamine hits that those fast-paced shows or TikTok videos or YouTube kid videos, anything really fast-paced gets the brain used to that. And then the kids don't want to read books. It's too slow and boring.
Right.
You train yourself to need a lot of input, and ADHD kids are susceptible to that. Their brains love that. They love those dopamine hits, but it's not good for them.
Right. And I find it's almost like working with a child. We don't want to tell them, oh, you can't have that toy or you can't have that piece of candy, because if you say that, they want it more. And so I try to take the approach, okay, let's find positive distractions, right? So, we're always going to have these inputs. We can't live without, there's going to be academic pressure. There's going to be the competition in sports. There's going to be social media and gaming and the challenges with sleep, with academics, but how can we bring in, mindfulness, journaling, at bedtime, ways to calm the brain. I know in our family, it's hiking, just being out in nature, how grounding that is. Because very few people can just sit still and meditate. But people don't understand that when you have, I have some of the, ADHD, and I call it the monkey brain when I just need to get outside and calm my mind. So I think if we can continue to focus on those things that really bring balance to those inputs. And I call them the supportive inputs to balance out the depleting inputs. And depending on genetics, some people are more sensitive to those inputs, and that those supportive ones are more important. I think also in working with you, there were also concerns of you had said iron is commonly deficient, but also zinc. I think zinc we overlook. You see this a lot as well as a common deficiency.
That's where the testing comes in. So I do blood testing and I can see what their iron levels are. And most of the kids are low on iron. And I'm assuming that is because of their diets where people don't eat as much red meat anymore. The kids eat more simple carbs. And so some of them are vegetarian even. So low iron comes up all the time, but I see that. I can't necessarily tell that till I get their blood testing unless, I know they're a vegetarian and I can see their diet where it doesn't contain enough iron, but they're often low in iron and zinc. Would be the two things. Everyone does not eat enough fish, and our fish supply is contaminated anyway, so you really don't want to eat fish every day. But that means the omega-3s are low. And so omega is another one that's low.
So some additional supplements that I like to recommend, I think, would be magnesium, because there are a lot of it's common to have a magnesium deficiency, especially for ADHD kiddos. And a lot of that does have to do with, soil quality today and food sources, but also just because of that, a general multivitamin, good quality multivitamin to make sure they're getting all those good micronutrients and active B vitamins and zinc and some iron, and vitamin D is a big one, and so many more. So, just to meet their basic needs. Yeah. So we're always on the same page. It's like we're singing to the choir. Another question I had was going back to the gut symptoms. I notice a lot of times there's constipation as an issue with a lot of my clients. What would you find in autism, ADHD? Is that a common symptom?
A very, very common symptom. And I really insist that everybody address that. So we add fiber, make sure kids are drinking enough fluids, fermented foods, and then magnesium. Magnesium citrate is usually what I use. So I want the kids to be having a bowel movement every day. And I just explain to them, this is, if you don't get rid of what your body doesn't need, it will reabsorb some of the bad stuff. And so you have to go every day. That just, without saying, that's part of health. And I think we were talking about, do I see then improvement in the ADHD? And I do many things at the same time. And so I can't always, and everyone gets better because we're working on, every part of their life that will make them healthier and able to function better. And so they all get better, but I can't always identify each separate thing that made them better. If it's big things that I'm working on, like say someone has a mold exposure or their gut, needs a lot more work. I do those things sequentially. So I won't put someone on, for instance, 20 supplements, to start with at the same time. So that's why, because we do our basics and then we just proceed from there, depending on what, what the patient needs or is able to do. So the first step is
Right.
always your basics and the nutrients, the nutrient deficiencies, your diet, your sleep, your stress, your screens. And then from there, we might do a gut test and work more on the microbiome.
Right. It's called like clearing the muddy water, right? Really knowing all of those many, many basic things that have an impact on our mental health and the function of our body, I think is great. And so do you look at, I know genetically, some people are more predisposed. Absolutely. What would you say what is the percent of cause, would you say, how much of it is genetic?
So there is an 80% heritability with ADHD. So there is not one gene. But it's high. And that's what I see in my practice, because I have siblings that have ADHD, the parents have ADHD. So it's a combination of genes. But we don't even know all the genes that are involved. And
right. It's so early, right? And the studying of genetics, there's so much more to learn.
Right. There are some genomic tests that can start to kind of sort that out, and they're generally not covered by insurance and they're very expensive, but they can point the way as to, like, if you have dopamine dysregulation, you need more norepinephrine than dopamine. Your receptors maybe don't work. So that can all be genetic, and you can look at that, and that can help you decide which supplements, in addition to your basic, make sure you don't have deficiencies, as well as I will look at the traits of people and be able to kind of ascertain what is going on in their brain, or combine the traits with the blood testing, and then try to address their brain chemicals with supplements. But a genetic test will kind of take it to the next level.
Yeah, kind of empower a person to understand their system better, versus feeling like, oh, I have an 80% chance, so I'm in trouble, I'm just going to have ADHD. More see it as something to empower you so you know how to address the imbalances to have improvements in genetic expression. Do you find the same high percentage in autism, or is that more cloudy, how much genetics plays a role with autism?
I think what I'm hearing from the research is that it's about the same, that there's no specific gene. So and the research is very early on. There's a lot of companies studying, trying to identify genes, but it's multifactorial, and that's
I mean, not to interject, but I'm so sorry, but I get excited about this because I can say for myself, who has ADHD, it is like a combination of genes. Like I have the MTHFR gene, I have the COMT gene, dysregulated, SOD2. So, my ability to detox is not as sufficient. So yes, it's like a combination of things. And then, of course, all MTHFR that affects neurotransmitter production, and how the microbiome can support that. So we could go on and on. But yeah, all of these things, it's a synergistic effect. And I think people want like one answer, one protocol, but that's why there isn't, because each person is so individual. Everyone has different genetics. And so we really need, and as you've found in your practice, I'm sure it's each person is unique and how you work with them.
I kind of go as far as patients want to go. So like you mentioned, detox. Well, even the step one with the supplements is helping detox and kick out heavy metals. But you can go further with that and actually test and treat. But I don't do that until everything else is in good shape.
Plus, you're reducing their intake of, toxins, like trying to reduce pesticides, chemicals, stuff like that. And so,
Right.
yeah, even things we breathe, like scented candles, like don't get me started. So anyway,
Right.
I know there's so much more we could say about this. We could talk on and on, but I know people have to get back to their lives, I guess. So I want to really thank you for being here. But is there anything final you would say to the audience that you think is important for youth to know today? What would you share?
Try to have a healthy lifestyle, and it's so much work for parents, but it pays off in the long run. I mean it, and it's not easy. You're going against the tide, but it's worth it. And, it's
Absolutely.
your investment in your children, the food they eat, the quality of what they're watching. Kids need parents to be there at every step, and it's worth it.
And it's a process. It's a journey. It's not perfect. It's never meant to go perfect. There's always challenges that come up, and that's okay too. But thank you so much. Those are great words you shared. So I definitely, absolutely want all of our listeners to know how they can find you, where you're located. If you could share some information about your practice.
So my practice is Integrative Pediatrics of Del Mar in Del Mar, California. My website is Lisa, Lisa, JLMD.com. And people can go on my website and email me or sign up for my practice. I do only see patients in California due to state license requirements, but and mainly I focus on ADHD and autism in my patients. But I'm glad to see anyone.
Well, thank you so much. I enjoyed our conversation, and have a wonderful day, and we will see you again.
Okay, thank you. Okay.
Wow. What a conversation with Dr. Loegering today. Really resonated with me on a personal level, with myself, with my family, but in the clients that I work with. Just the things that we can do to take care of our mental health, yet also how challenging it is in our culture today, with the challenges of academic pressure and fast foods, being in a hurry, social media, all of those things that are constantly coming at us. And so really, the answer isn't about getting it perfect. It's about looking at our lives and what are those small changes that we can make to really support our mental health, because it really does make a difference, and it's a journey, and it does take time. So if any of this resonated with you today, please leave a comment below. Or if you're just listening, hop on over to my YouTube channel, and you can see that link below in the show notes. And let's keep this conversation going. And until next time, be well.